Hi, Assalamualaikum and a very good morning to audience and panelists. It was a great day today, right? To discuss and debate about news. By the way, my name is NURWAFI ATIQAH binti ALIZAM and I am the moderator for today's forum. Nowadays, many diseases and health problems happen around us. So, our forum is all about the depression and drug abuse. Here we have three panelists that can share their information and point of view about it. There's Prof. Muhammad ZAFRI bin Muhammadin. Next, Dr. Muhammad ARDIV FIRDAUS bin Muhammad ROZAINI. Lastly, we do have Dr. SITI AISYAH binti Muhammad KHAIR. It was an honor and pleasure to have all of you in our forum for today. Thank you so much for spending your time, Dr. Prof. First of all, we all should know what is depression and drug abuse. I hope you all are excited to get through this forum today, okay? Basically, depression is a serious mental condition that gives negative effect to how we feel, how we think, and how we act, which could lead to the death. While drug abuse is overdose or misuse of medical prescription that lead to the negative health condition that gives social, physical, and emotional problems. For that, without wasting time, I would like to give the first question, which is, what is the causes depression and how it tracks people into drug abuse? I would like to give this question to Prof. Muhammad ZAFRI Bending. Carry on, Prof.
Thank you to our moderator for today. Okay, now I'm going to talk about what causes depression and how it drags people into drug abuse. Okay, firstly, many of those who suffer from depression are unaware that they have the problem, and because of that, they do not get proper treatment. In addition, societal misconception of this matter cause those who suffer from this problem do not to be referred to the right place. Even the depression they face is often belittled by those around them. Patients who experience depression in early childhood are more due to environment condition than hereditary. It may be a situation in the family or school that cause the depression. But for those who experience depression during teenager, it is more related to genetic factor. There are two main causes of depression. First is genetic, or we can call it hereditary. Those who have siblings or parents who suffer from depression will have 3 times the risk of getting the problem as well. But this does not mean that those who do not have a family history with depression will not have the problem. So we all have to be careful. Second is about stress. Feeling of stress or the loss of a loved one can be a risk of factor for depression. Those who are adult and have illness that lead to disability or even an inability to take care of themselves will cause a sense of uselessness and they can become depressed. But I can tell you some other psychosocial factor that can put stress on patient as follows. First is lack of community support. Second is burden to support family. Third is loneliness. And last one is the death of a loved one. What I'm going to talk after this is more important. Alright. All too often, depression serves as a gateway into drug abuse. There are many reasons for this. It is well known that people who suffer from depression often to drug to escape the negative effect of severe depression. But depressed patients who do not seek treatment will remain depressed to a greater extent as long as they do not get treatment. Likewise, suppose drug use is prevalent by such individual. Moreover, since men and women tend to self-medicate with drugs to escape their severe depression, the risk is that they will continue to use this substance in even more dangerous way than before. If you stop using the substance, your depression can worsen. particularly if you suffer from severe depression. If you've been taking drugs to cure your symptom of depression for years, you may find that your depression become more pronounced than you become sober. Treatment for both drug abuse and depression must be coordinated, and that is why this must also be done in tandem with the treatment for severe depression. My final advice is, do not even think about trying to take drugs even once, because it is highly addictive. There is high chance that once you try it, that you will be addicted to it instantly. That's all from me. Thank you. Continue to our moderator.
Thank you, Prof. Muhammad ZAFRI, for the information. Surely we all know that depression and drug abuse give bad effect on our health. But what it is and what that bad effects? Without further ado, I will present Dr. Muhammad FIRDAUS bin Muhammad ROZAINI to give his talk about effects of depression and drug abuse.
There are many bad effects for people who take drugs. Not only effect individually, but it also gives effect to family and society. First, I will share some effects of drugs on individuals. Individuals who take more drugs tend to get involved in fights and accidents. It will cause death to the person who take drugs, because the people who take drugs will drive dangerously without any cautions. It will cause endangering the safety of other drivers on the road. Drugs also can cause mental health problems for at-risk individuals, because drugs have adverse effects on the brain. The brain will fail to function properly to think. Severe drug addiction can lower a person's immune system, and they are easily to get infection. Drug users are vulnerable to infectious disease such as HIV or AIDS, hepatitis, tuberculosis, and others. It will give a bad effect on the people around you. People around you will easily infected with the disease. The risk of infection is not only limited to those who take drugs by injection only, because in general, all those who take drugs tend to commit other risky acts. This will happen when the people who take drugs sharing personal belonging with other people who did not take drugs. For example, shirt, cups, or mineral bottle. Third, the effects of drugs on society. Drug use and addiction can affect society because costs required to arrest and rehabilitate drug addicts will be more high that can afford by the government, so it will easily increasing crime rates and infectious disease in the community. It will also increase medical costs to cure disease suffered by drug addicts. It will make many loss and damage due to treatment crime, because the people who take drugs easy to do damage because of being in an uncontrollable state. It will produce to an immoral generation that will easily affected in adolescent. It will make many disadvantage in society.
Wow, that is a very good information and reminder from you, Dr. ARDIV. Thank you so much, Doctor. It is scary to hear about the bad effect just now. I strongly believe that we all love our life because we only live once, right? By that, let's hear from Dr. Siti AISYAH binti Muhammad KHAIR about on how to manage our mental health and avoid depression, also get rid of drug abuse. Carry on, Dr. Aisyah.
Thank you for giving me this opportunity to share about how to manage mental health, the way to avoid depression, and also how to get rid of drug abuse. When we with the right treatment and support, it is possible to us in preventing the disruptive effect of drug use and regain control of our life. Today, I'm going to share with you a few steps that can make change in our life. Firstly, is by build a strong relationship. When you have a strong support system and active social life, it's giving a good impact for our mental health. Research has shown that having even a minor social support can help in handling depression. You can make sure that you are regularly connecting with friends and family, even when your life are busy. For example, by attending school event, you can find a new hobbies that could help you meet new people who can help you build a brand new connection to increase your social battery. And lastly, having a mutual relationship. Second step, exercise regularly is one of the best things that you can do for your mental health. Exercise can help in the treatment and prevention of depression in several ways, which is by doing a brain-changing activity such as yoga, strength training, and workout. Third, you can reduce alcohol and drug use. The excessive use of alcohol and any drug use not only associated with higher risk of depression but also higher risk of health problems. We can limit alcohol intake and eliminate any drug use as safely as possible. Limiting alcohol can be difficult in some people, as you can reduce it by ordering an appetizer of a drink at happy hour instead of alcohol. Or you can plan and invite friends to event where alcohol is not the central. The last step is by getting off nicotine, because smoking and depression can perpetuate each other. Even though any type of nicotine, it can act as depression trigger. To stop smoking, you can try to focus on your reason for quitting and remind yourself of this every time you are tempted to smoke again. Or you can try to tell your friends or family and ask them to help you hold you accountable. That's all the tips that I can share with you. No matter how much tips I give, if you still didn't have a courage to change, you still can't change. No one can change you. It's all about yourself. Now we can return the session to our moderator. Thank you.
Thank you so much to Dr. Siti Aisyah and to all the panelists for the speech just now. It was a pleasure to hear from all of you. And thank you for the great information that you're willing to share with us. By that, I hope that all the audience to take this information as much as well. Remember that we have many people who care and love us. So don't do things according to your feeling. Please calm down first so that we can remain positive. Also, everyone plays an important role in preventing this problem. I assure you guys that if you strongly forbid and control this problem, we can live happily and harmony. It also can help our country to develop better for our future. That's all from me, and that's all for forum for today. Thank you so much for spending your time. Thank you.